Female orgasmic disorder, causes, symptoms, and treatment. We explain what female orgasmic disorder is and how it can be overcome through treatment. Sexuality is an intrinsic aspect of many women's lives, and orgasm is the culmination of that experience. However, female orgasmic disorder presents itself as a challenge that some women face in their sexual life. In this article, we will delve into TOF, exploring its most relevant aspects and presenting tips to address this problem. The female orgasmic disorder, exploring the challenge of female pleasure. TOF is characterized by recurrent difficulty or inability to achieve orgasm after adequate sexual arousal. It is important to remember that experiencing occasional difficulties reaching orgasm does not necessarily constitute a disorder. However, when these difficulties become persistent and cause distress, they are classified as female orgasmic disorder. Causes of female orgasmic disorder. Female orgasmic disorder is a complex problem with varied causes that can differ from woman to woman. Here, we look at some of the most common causes. Emotional factors. Anxiety, stress, depression, and previous sexual trauma can be triggers for female orgasmic disorder. These emotional factors can create a barrier to relaxation and enjoyment during sexual activity. Physical factors. Certain medical conditions, such as diabetes or neurological problems, can influence sexual function and contribute to female orgasmic disorder. Additionally, some medications, such as antidepressants, can have side effects that make it difficult to orgasm. Relational factors. Relationship problems, lack of sexual communication, and emotional tensions can negatively impact a woman's ability to achieve orgasm. Lack of connection in the relationship can be a major challenge. Sociocultural factors. Poor sexuality education or negative cultural beliefs about sexuality can influence a woman's perception of her own body and her ability to experience sexual pleasure. Treatment and strategies to address female orgasmic disorder. TOF is a problem that can be treated from several perspectives, and choosing the right solution will depend on the underlying causes and personal preferences. Here are some strategies to address female orgasmic disorder. Sex therapy. Sex therapy, led by a specialized sex therapist, can be beneficial in addressing the emotional and relational aspects of female orgasmic disorder. Helps identify and treat emotional concerns that may interfere with orgasm. Pelvic floor exercises. Kegel exercises strengthen the pelvic floor muscles, which can increase sensation during sex and make orgasm easier. They are simple exercises that can be done at any time. Sexual education, knowing your own body and female sexuality better, can be empowering. Sex education can help a woman understand her sexual needs and desires, thereby improving her ability to achieve orgasm. Medical treatments. In some cases, medical treatments or medications may be considered to address the physical causes of TOF. Consulting a health professional is essential before making this decision. Individual and couple exploration. Experimenting with different types of sexual stimulation, whether alone or with a partner, can be helpful in discovering what works best. Open communication with your partner is key in this process. Variation in sexual activity. Sexual routine may contribute to TOF in some women. Introducing variation into sexual activity can maintain excitement and interest. This may include trying new positions, experimenting with tantra, longer foreplay, or even changing the location of sexual activity. Novelty can be stimulating and help overcome the barriers that make orgasm difficult. Hormone considerations, hormonal fluctuations throughout a woman's menstrual cycle can affect her sexual response. Some women find that they have orgasms more easily at certain times in their menstrual cycle than at others. Being aware of these variations can be helpful in managing sexual expectations and performance. Couples therapy. If female orgasmic disorder is affecting your relationship, consider couples therapy may be an effective solution. A couples therapist specialized in sexual issues can help improve communication and intimacy in the relationship. The importance of self care and general well being. A woman's general well being has a direct impact on her sex life. Maintaining a healthy lifestyle that includes regular exercise, a balanced diet, and sufficient rest can have a positive effect on sexual function. Additionally, stress reduction and promotion of self care. Female orgasmic disorder is a challenge faced by many women around the world. It is important to recognize that you are not alone and that there are various options to address it. The key is to identify the underlying causes and seek help when necessary, whether through therapy, exercises, sex education, or other solutions. Sexuality is a natural and healthy part of life, and working on overcoming female orgasmic disorder can lead to a more satisfying and fulfilling sex life for all women.